our French citizens. Thank you, Madam Minister. Today is the 7th of May. We have 4 days left until the 11th. The coming Monday will be the new step, a new chapter. We will be able to get back to our regular social lives. It won't be entirely normal, as has already been mentioned by a number of our ministers, but it will be a new chapter. But it requires all of us, all French men and women, to act disciplined and to act responsibly. And again, this is the first chapter, and the next chapter will last a number of weeks, because the virus will continue to live on with this. But I am confident in our ability to all of us deal with the current situation and to act with discipline and responsibility. The progressive deconfinement that we're going to go through should not see us let down our guard. In the coming days, in the coming weeks, we have to think practically, because all throughout May, we will have to, from a government side, adapt our plan to continue the ongoing dialogue with elected officials, to hear the challenges that they are facing and take them on board. I would like to thank from the bottom of my heart all those people who have been able to ensure that the 11th of May will be a success. Mayors, of course, because the mayors are at the very heart of our mechanism here. Prefects, companies, all local health centres, any state officials who have been in their own capacity, in their own function, in their own sense of responsibility, have been able to help us to prepare and are continuing to enable us to prepare for the post-lockdown period. And from the 11th of May up until the end of May, we will be able to see where we are at. We will be able to take stock. We will be able to say at the end of May whether we have overcome the crisis. We will be able to closely evaluate and monitor new entries to hospital, new cases, new deaths. If these figures stay low, we will be able to move on to the next stage. We will be able to open up to new areas, those key areas for the coming summer. However, if the figures don't change, if they increase, then we will have to take stock of that situation. And obviously, future confinement measures maybe have to be brought back in place. I have to mention that. So therefore I call on all of you, because I think it is going to be a welcome time come next Monday for people to be able to breathe a sense of an air of freedom, to be able to go back out into nature. For those people who have been locked down for the past month and a half, 2 months in the center of our urban hubs. I think all of our French citizens would want to be able to utilize that new sense of freedom. But we also need to stay wary and be precautious. The plan that has just been mentioned and discussed and will be disclosed in the coming days outlines a number of guidelines, not necessarily assertions, but guidelines, and there are some which are very strict guidelines where if they are not respected by, they will entail a fine. But I think what is so important here is not necessarily the fine, but the meaning behind the rule that is trying to be enforced. Why do we have those rules? Because we need to ensure the current health situation of our country, because we need to ensure that we can be in a safe situation to get back to work. And we need to strike a balance there between those different points. And we can only strike that balance if we can trust each other. It's not just about citizens having trust in the government or public authorities. It is about trusting each other, people trusting each other. If we can entrust each other with having understood what is at stake here. And me, I have faith and I trust that we have understood and the French have understood. I would now like to field any questions that our press relations secretaries would have for us. Prime Minister for Le Quotidien Groupe Ebra from the eastern regions of France. Before handing over to the questions by my fellow journalists, I would just like to make mention of the fact that there are red and green departments, and I think the French citizens wanted to see the new map. Obviously, we can see that there are different levels of risk depending on whether you're in the red or green regions. If you live in Toulouse or Mulhouse, it's not the same situation. But yet, it seems that there are some areas that will still remain closed, parks and secondary schools. So are you trying to say that we're living in two sorts of Frances here?
France, let's be clear about that. You must not imagine that there should be a two-speed France. But everywhere one must be prudent, one must be careful. Everywhere the preventive measures and physical distancing has to be respected. Whether you're in a green department or a red department, you cannot play around with this virus. You have to be very concentrated on it. What is true is that in green departments, the situation is objectively better, often because the hospital system is more available in those areas. It has been under less of a burden, and it could react to a situation if things did get worse. This means that in red departments, it is true that we have to be even more careful, which is why we've postponed the opening up of middle schools and why we've suspended the areas of social life. But this distinction between green areas and red areas, which exists and which will remain after the 11th of May, the goal of this division is maybe to evolve in June. In the departments that will remain green, meaning in the departments which during the following 3 weeks will allow us to see that we are managing the circulation of the virus, in those places we'll be able to go further at the beginning of June. In those departments that have not passed into green, it will not be possible to relax these measures, and we won't be able to go as far. So you see that this instrument, which allows us to differentiate between these areas today, will, of course, change over time. Another word on the distinction between the green and red departments. I have mentioned that when there have been doubts on such and such a measure, when prefects and mayors are talking on a very local level on the way that they can interpret or implement these rules, if you're in a red or a green department, this is something that obviously is a very precious help. This gives you you should have more prudence in red department than in green department. So that is why there is this distinction. And let me say this once again, that in territories that are already red, in 2 territories, in Mayotte and in the Greater Paris area, we will have to have even more vigilance than elsewhere.
Bonjour, Julien
Hello, Julien Gaspard from France Television. In order to continue on this first question, and I'd like to relay a question from my colleagues from BFM. You mentioned the 2nd of June on this map. Will this map be re-evaluated every day as it has been? And if the epidemic progresses in a negative direction, if it gets worse, will you be able to change the rules in certain regions? I spoke about this with the Minister of Health and Solidarity, who might be able to add something to what I'll say. But the first thing I'd like to say very clearly is that all the indicators that the Health Ministry presented you will be followed up on daily. And we have wanted them to be made public, understood by all our fellow citizens. And so they will be monitored daily, these criteria that we brought up. And of course, if everything remains green, that's good. And if everything remains red, even if things improve a bit, but without very important improvement that would allow it to become green, well, we'll see. There are measures. If we went from red to green, there are measures that take time. So let me speak hypothetically. I have to be careful when speaking hypothetically. But imagine if in one department, in 4 days, imagine if it becomes green suddenly. We wouldn't be ready on the 15th or 16th of May to start allowing children back to middle school the following Monday. So we will be careful. We will monitor the character of these improvements to see if they are long-lasting, and then we will proceed in 3-week periods in order to be able to have more visibility, be able to forecast better. I don't know if the Minister of Health would like to say anything. I think you've said it all. Maybe there's just one thing. I'd like to remind you that the indicators on the epidemic are always based on 7 days. They're weekly figures, so they're assessed every 7 days. So we analyze each territory, and we can see that there are certain territories where you can see an indicator that might look green, but it might be surrounded by other territories where the virus is actively circulating. There are also departments where people might reside, but they actually work in other departments and where the virus is circulating. So you have to be careful when looking at these maps, because this is a time-stamped photograph that takes into account the specificities of each territory, but you can't just look at the figures. You really have to look at the reality of each territory. Another indicator will be very important starting on Monday. It might not be a daily thing, but we'll be looking at things transparently. We send our data, we publish them online. You can find them on the government data, but the important thing will be the number of positive tests, the tests that are returned positive for each territory. That is something that is very important, a very important indicator. Today we have an indicator for the active circulation, which is based on people in hospitals, in ICU units. But this is not as fine-tuned. If we have a much better indicator tomorrow, if we have an indicator that's based on positive tests, this will be very important for us to monitor. And it will give us the opportunity to see if we're able to carry out all the tests that we want to in a given territory. And if the circulation of the virus is slowed down in next week, for example, or the week afterwards, maybe the number of tests that we will carry out will be lower, since the number of people that needs to be tested will be lower too. So the situation has to be analyzed. We have to explain and analyze this data, because it's not easy to just understand it as such. A question that was asked by many different media sources, including RFI and others, is about the plan of going back into lockdown that was brought up by the Minister of the Interior. Is this a plan that you have taken into account, and when would this decision be taken to go back into confinement? This is something that we have to plan for. We have to plan for everything, at least everything that we can plan for. So we have always stated that we'd like to avoid to have to get to this point of going back into a lockdown. But if there is no other solution, we cannot completely set this aside. If we were to go back into lockdown, this would depend on how quickly the virus is circulating and on many other factors that I can't present to you. I can't present all of them to you today. But everything that we're doing has one goal, which is to make sure that we do not have to go back into lockdown, which would be very negative for our country, very demoralizing for all French people, very dangerous for our health system and for the state of the nation. We have to be vigilant in the phase that is going to start on Monday in order to avoid having to face another lockdown. A question that was asked by numerous media from RTL, LCE and others. Can you give us some details on the movements within the 100-kilometer radius? Will this just be a document you'll have to, a sort of sworn affidavit or something else? And if you send your children to your grandparents beyond this 100-kilometer radius, would this be a reason, a good enough reason to travel? I'd like to say, as we've already said with the health minister, even if we trust the responsibility of each of our fellow citizens to respect good behaviors and preventive measures, for elderly people and the most vulnerable, the limiting contacts is a measure that has to be respected. I have to say this again. It doesn't make me happy to say this, but it is essential in the Paris area to limit these contacts. And of course, it's useful everywhere in the country. Let's try and understand the logic of this rule, the spirit of this rule. We want to avoid having this virus circulate quickly in the country. And in order to do that, we have to reduce social mixing. We have to avoid movements of people from one end of the country to the other. We have to make sure that they're almost impossible, as limited as possible. It's not to annoy French people. It's not to make life difficult for our citizens. Of course, we'd all like to go back to our normal freedoms, to being able to move around freely and enjoy our freedoms. But we want to avoid the disease from spreading too fast by reducing the social mixing. And so that's why we're limiting movement to this radius of 100 kilometers, and only for compelling reasons, for essential work-related reasons, can you leave this radius. So, for example, if a lawyer has to go plead in another department, if he has to go beyond this 100-kilometer radius, because he might be working in a different city. So this would be a compelling work-related reason. If someone dies in your family, that is also a compelling reason, a compelling family reason. Everyone understands that. Helping a vulnerable family member or a vulnerable child is also a compelling reason for traveling beyond this 100-kilometer radius. A simple visit for pleasure, for fun, going to your summer home. These things are not compelling reasons. And so as far as possible, these have to be banned. When it comes to public transportation, which will be able to be accessed with an employer's certificate only in the Île-de-France area, the Paris area, would this be something that might be rolled out in other cities? Well, we would like to allow the local transport authorities and the local authorities who are responsible for organizing public transportation, we'd like them to have the keys in hand. If for organizing public transportation in a given city, the local authority that is responsible for this tells us, please help us, let's organize a system together in order to make sure that people have a work certificate to be able to use public transportation certain hours. We will help implement this system. This is what happened in Paris. It was the president of the Paris Transport Authority, Valérie Pécresse, who asked us to implement such a system. And we said, in line with what we'd said, that we would help her to set this sort of system up. I have a question on going back to school. You said this would be a voluntary going back to school, and many parents are wondering whether they should send their children back to school or not. The Canadian Prime Minister said that he didn't know if he would send his children back to school. You, personally, will you send your children back to school? And if so or not, why? I don't usually talk about my children in public. One of them is in the 11th grade in high school. The other one is in middle school. And my youngest is in elementary school. The youngest one could go back to school. I would prefer her to be able to go back to school. But after a meeting with the professors, her teachers, her class, we decided that if there are pupils who are in greater need, she would give them her place. What guarantee can you give to teachers and parents who are asking themselves many questions today? On the one hand, on the health guarantees and also on the educational imperative of sending their children back to school. I believe in the French people's common sense. I think that all our fellow citizens are convinced that it is in their children's interest to go to school. I don't know anyone who one day has said to themselves that the best thing for their child is not to go to school. I think our fellow citizens are full of common sense. And I also understand that given the situation that we're living in, which is quite a specific situation, I understand that they might ask themselves questions about the risks that their children may be submitted to if they did go back to school. These worries, they have to be addressed. They have to be addressed. We have to explain what is being done. And my feeling is that what is being done by the national education authorities and by the local authorities will show, maybe progressively, maybe gradually, maybe not on the first day, but will show eventually that the measures that we have proposed, that we've explained, are being implemented, and that schooling can take off again, gradually. We don't want to force our citizens to send their children to school. We want to convince them, and that is how we will do things. I'm speaking in the name of the Education Minister. I hope he doesn't hold this against me. But our common position is that gradually we will see that things are going well. And since things are going well, there's an obvious interest for our children to go back to school. I have several questions on masks. Questions from BFM, from Washington, and from RFI, which I'd like to bring together. Local representatives would like to make masks compulsory in public spaces. Why is the state not saying the same thing? Why also isn't the state giving out free masks to all French citizens? And last question, are you going to ration mask sales to avoid any shortages? Well, there are many questions. I'll try to be as clear as possible in my answer. First of all, the state will give out masks. They will be distributed to school teachers who will have to wear them in their classrooms. Masks will be given out to agents who need them. They will be given out to the most vulnerable among us. There are 5 million masks that will be distributed every week by the state, by the local prefects, so that the most vulnerable among us, vulnerable because of their health, but also vulnerable, economically vulnerable, that they be given free masks, that they have access to free masks. I'd also like to say that the state have undertaken measures that will finance 50% of the mask buying costs, which will be retroactive for masks that were bought since the 13th of April. So the state will pay for half of the cost of masks that may be given out freely by local authorities. This is something that has to be repeated and taken into account. When it comes to the masks, some of them will be distributed, some of them will be given out, some will be bought by our fellow citizens in supermarkets and pharmacies and tobacconists and so on. That's common sense. If we want everyone to be well armed over time, these masks have to be available everywhere. Their price has to be controlled too. They have to be cheap. So we've also regulated the price of these masks to make sure that we have the possibility for to be able to buy them in the most places possible. Wearing masks in public is not something that we've all decided is a mandatory measure. The mask is, remember, complementary to physical distancing and barrier gestures. When you're walking alone in the street, in the countryside, wearing a mask is not really that important, and so that's why we didn't decide to make wearing a mask absolutely compulsory all the time, but only in certain cases, and we recommend its use in other cases. Another question on the masks. According to our colleagues from Le Monde, your council has discovered during the crisis that millions of masks that were out of date were burnt. Could you confirm this information and give us more information? Yes. Well, what happened is that a certain number of masks that had been ordered many years ago and that had been kept for a long time were past their expiry date, and sometimes way past their expiry date. Let me give you a few figures so that you understand what the scale of this is. In our stockpiles, we found, with different ministries and different teams working on this topic, we found a stockpile of 75 million masks that expired in December 2019. So when you having found them in the spring or the winter of 2020, since they reached expiry date at the end of 2019, you could say to yourself that it might be absurd to destroy them, which would normally be the case, that you would check if you could use them and use them. And that's what we did. We tested them, we saw if we could use them, and so we found the 75 million masks that were usable. But there were other masks whose expiry dates were older. They'd expired much longer before. There were 360 million such expired masks. And among this stockpile of masks, we also saw what was usable, and there weren't that many that could be used. Many of them were very old, and some of them were just beyond use. And we did different tests and studies, and this allowed us to see that they could be used, not as surgical masks, because surgical masks, as you know, have to abide by different, very specific criteria, but they could be used as masks for the general public. And that's what we did. So we have a stockpile of 85 million masks out of the 360 million that could be used again. The rest of them are no longer usable. And because they're no longer usable, they will have to be destroyed. I have a question from Marianne. When a person will declare that they've been contaminated, and if they say who they came into contact with in the days before that, what will the state do with their data and for how long? And I'd like to add a question from the AFP. Can you guarantee that there will be enough people in the different teams, knowing that there should be, that Professor de Bressy recommends there be 30,000 people? Minister of Health. After this conference, I'll go back to Parliament to continue on this very important debate that you've brought up when it comes to the essential digital tools. These digital tools are essential for us to be able to carry out our epidemiological studies, to be able to control people who have potentially been exposed to someone who has been infected with the virus. What we want to do is make sure that we have a minimum amount of data to see if the test is positive or negative, to see if there's symptoms that support illness. There will not be a national roster of this information. There's already a file called Amélie Pro, which diabetics already know. They already are on this database. This is a database, Amélie Pro, that is used by doctors and other health professionals. So we will just extend this database for this very specific task of fighting the coronavirus epidemic. We, in our country, we do not want to create databases for any other reasons. We are just working on this specific problem. We want to work on this essential issue. So when you're tested, we don't want the results to be lost. We want this test to be identified, for it to go to a lab, then we want the information to be shared with health insurance and the other important actors so that you can be contacted. And so if we contact you, if I call you as someone who works with the health insurance, I need to have a file, a database in which I can write down the different people I need to contact to check to see if they were real contact cases, to see if they need to be protected or not. So this information system will only last for the length of the epidemic itself. Now, I understand when we speak about databases and health, there are many questions which senators have started to answer to, and we're debating it in Parliament. Of course, we are in a democratic discussion, but it is necessary. We need these applications, which is not linked to a digital tracking system. We're just talking about this national database. Now, when it comes to the teams, these brigades, there's maybe a bit of confusion. There's people who will look after sick people and the contact cases to make sure, to see if you're sick, to help you, to call you to give you your results, or to help you carry out your tests. So there's a lot of people working in these on this, because any doctor can really work on this. So there's tens of thousands of people. But then there's a specific team within the health insurance sector with maybe 3,000, 4,000, 5,000 people. This team could be reinforced. And then there'll be teams in the local health authorities which will come and work in the clusters where there's a lot of viral activity. And then there will be local teams that will work with the local prefects. And there are thousands of people who will be working to check, if you're in isolation, to check that you have something to eat and that you're not going through any difficulties. So it's a whole team fighting against coronavirus in each location, in each territory, to come and support you and help you. A question from our colleagues from AFP.
You were listening